In this video we are going to talk very simply about clinical implications of endocrine malfunctions. We're just going to go over the basics. We'll talk about the hormone, what happens when it is underproduced, some principal symptoms, and what happens when it is overproduced, and some principal symptoms in those cases. So let's get started. Growth hormone. When there is an underproduction, we have the pituitary growth failure in children, and the principal symptoms here would be retarded growth, abnormal fat distribution, low blood glucose hours after a meal. And what happens when there is an overproduction of growth hormone? We would have giantism in children or acromegaly in adults. And the symptoms here would be excessive growth in stature of a child or in the face and hands of an adult. Next, ADH, or antidiuretic hormone, or vasopressin. When there is underproduction, you would have diabetes insipidus. Principal symptoms here would be polyuria. Overproduction, you would have SIADH, or syndrome of inappropriate ADH secretion. And the symptoms here would be increased body water content and hyponatremia. Next, thyroxine, T3 and T4. Underproduction, you'd have myxedema or cretinism. Principal symptoms here would be low metabolic rate, body temperature, impaired physical and mental development. And in overproduction, you would have Graves' disease. Principal symptoms here would be high metabolic rate, body temperature, tachycardia, and weight loss. Let's talk now about parathyroid hormone, or PTH. When there is underproduction, you would have hypoparathyroidism, and you would see muscular weakness, neurological problems, tetany due to low blood calcium concentrations. And in overproduction, you would have hyperparathyroidism, so we would see neurological, mental, muscular problems due to high blood calcium concentrations, weak and brittle bones. Next, insulin. Underproduction, you'd have diabetes mellitus. Principal symptoms: high blood glucose, impaired glucose utilization, dependence on lipids for energy, glucosuria, ketosis, and overproduction of insulin, you would have excess insulin production or administration. And in the principal symptoms here, we would have low blood glucose levels and possibly causing a coma. Next, mineralocorticoids. Underproduction, you would have hypoaldosteronism, and the principal symptoms here would be polyuria, low blood volume, high blood potassium concentrations. And overproduction, we have aldosteronism, which is shown by increased body weight due to water retention, low blood potassium concentrations. Next, glucocorticoids. And underproduction, you'd have Addison's disease. Principal symptoms here would be inability to tolerate stress, mobilization of energy reserves, and maintain normal blood glucose concentrations. Overproduction, you'd have Cushing's disease, and you'd see excessive breakdown of tissue proteins and lipid reserves, and impaired glucose metabolism. Next, epinephrine and norepinephrine. For underproduction, none have been identified, and for overproduction, you'd have pheochromocytoma, and here there would be a high metabolic rate, body temperature, and heart rate. Elevated blood glucose levels are the symptoms comparable to those of excessive autonomic stimulation. And next, we will talk about estrogens. For example, in females, we would have hypogonadism, and this would result in sterility and lack of secondary sexual characteristics. And there would be cessation of ovulation. So in this case, we're talking about menopause. Then in the same case, we're talking about estrogens here. When there is an overproduction, you would have androgenital syndrome, which is an overproduction of androgens by the zona reticularis of the suprarenal cortex, leading to masculinization. And in the case where there is precocious puberty, there would be early production of developing follicles and estrogen secretion. Next, androgens in the case of males. Underproduction, we would have hypogonadism, eunuchoidism, and the principal symptoms here would be sterility, lack of secondary sexual characteristics. And in the overproduction, we would have gynecomastia, and he would have abnormal production of estrogens, sometimes due to suprarenal or intestinal cell tumors, which would lead to breast enlargement. And also there could be precocious puberty, early productions of androgens leading to premature physical development and behavioral changes.